Good morning. Today we're going to talk about what do I do when somebody comes into my office complaining of back pain. Now the first thing that I like to do is I like to kind of get into their head and figure out why do they have back pain, what's making it better, what's making it worse, and is this somebody who really wants to get better? A lot of my patients come in and they want me to just write a pill. Fix me, I took a pill, my pain goes away. Okay, well I imagine these people are smart enough to understand if you drive to your mechanic's office or your mechanic's garage, okay, and you say, hey mechanic, I've got this circular light on my dashboard. No matter what I do, this light's blaring me in the eyes and it's bugging me and it says oil, oil, oil. And what do? The mechanic reaches around the back and you think he's going to grab a quart of oil because your car needs something, so it has a warning light. You give it what it needs, the warning light goes away. Correct? Sounds simple, but what would you do if your mechanic gave you a little circular piece of tape and said, hey, put this right on your dashboard, right over that light, that'll fix the problem? Everybody's kind of laughing. You think it's funny? We live in a country conditioned to believe that the first line of therapy to get rid of a pain piece of circular tape. And we would never even treat our car that way. Your car ain't worth nothing. Your life is what's worth something. And your happiness in how you live your life, that's what is conveyed to not only your inner person, but those around you. So take care of yourself the right way. And if you're taking pills to get rid of your back pain, look at yourself in the mirror and ask yourself, do I really need these pills? And is this the way that I want my kids to grow and treat themselves? And say that I don't have time to go work out, I don't have time to eat right. What kind of a message are you giving to your children? So we always have time to eat right, we always have time to exercise, and we always have time to love and care about each other. So, what do I do to fix your back? Once I kind of get into your head and figure out what your family life like and your lifestyle and your job and how healthy are you, and if you smoke, I don't even listen to you, okay? Cigarette smokers, unfortunately, you were conditioned the wrong way, and tobacco should actually be illegal for what it does to your body, and that is my opinion. I know there's all kinds of people that get upset by things like that, and patients always tell me, you can't tell me to quit smoking, but I tell them, actually, you're paying for my opinion, so yes, I can. And you actually need to quit smoking because nicotine itself is the most damaging thing you can do to your blood vessels. It makes your blood vessels not want to make new ones. And your blood is the only thing that makes you heal. So in your body, if you decrease your blood flow, you decrease the amount of nutrition you're getting with your diet, you decrease your activity. All of these things play havoc on your circulation. Once your circulation starts to get messed up, your body breaks down. When your body starts to break down, there's only a few things that you can do to fix it. So that's what pain is, essentially. Pain is a warning signal, just like your car has a warning light when it needs something. And you say, well, what is it that I need when I'm in pain? Well, it's very simple. Oxygen, sugar, and then more oxygen and more sugar. And it's not the kind of sugar that's white powdered that you put in your coffee. It's the kind of sugar that comes naturally from foods. Any kind of processed sugar is terrible for your body. That's why we live in a country full of diabetics, is poor dietary counseling. Just throw out the white sugar. There's all kinds of modifications. I grew up in a gourmet household. My mother is a gourmet cook. I pride myself in my baking, and I try really hard not to use sugar. Now, butter, that's one thing that I can't get rid of completely in my baking because you try to make phyllo crispy without using butter. So, the bottom line, getting back to what is it that we need? Sugar and oxygen. What delivers that stuff? So nutrients and oxygen. That's how your blood vessels deliver nutrients to your muscles. Your muscles need oxygen, sugar constantly. When you're not toned, your blood vessels clog up. They get cholesterol. That also comes from a part of what you eat. There are genetic predispositions to having issues. However, no matter what your genetic problem is, you can always be as healthy as possible for the problem that you have. So getting back to pain. Pain is your body telling you that you need something. Everybody knows that if you grab a dumbbell and you start doing curls, 5, 6 of them, no big deal, 7, 8, 9, 10, you start to feel a sensation in your arm. Then you start to feel a burning sensation in your arm. And then you stop and you recover. Then you pick up the dumbbell again and you do it on the other side, and the same kind of thing happens. It'll happen all over your body. And we call that fatigue, we call that lactic acid buildup, we call that all kinds of things. But essentially what's happening is when you flex a muscle, you actually have poor blood flow. But it's the kind of cruel to be kind, because by working out your muscles, you actually overall improve the blood flow to them at a natural state and make them more ready to recover and more likely to function in a stressed situation compared to muscles that aren't stressed. So when you're exercising, your body utilizes certain nutrients, oxygen, and when you don't have these types of nutrients and oxygen being delivered to your tissues, you have pain. That's plain and simple.